So this is breast scenario number 4, coding drill on SEER Educate. The patient was diagnosed with invasive ductal carcinoma of the left breast at 3 o'clock by needle core biopsy on 2/5/25. A prominent left axillary lymph node was identified on ultrasound and was subsequently core biopsied on 2/12/25. The left axillary lymph node needle core biopsy was negative for carcinoma per pathology report. So now we're going to go into the surgeries. So just I like to take note that the diagnosis includes the left breast. Now when they mention surgeries, they talk about undergoing a bilateral skin sparing mastectomy. There's a code for when there's a mastectomy on the diagnosed breast or diagnosed side, and including the non-diagnosed side. So that would be the without removal of uninvolved contralateral breast. So here it says bilateral skin sparing mastectomy with removal of uninvolved contralateral breast. I believe this is it. I haven't done this one in a while. So let's just double check. B320, removal of uninvolved contralateral breast. Yes. It is performed with and without sentinel code bio. Yeah, so I think it's this one. Let's keep going. Lymph node biopsy and reconstruction on 3/27/25. So we can put here, right here, there's a reconstruction breast. So we could take note that there was a reconstruction. What kind? Let's see. Underwent immediate reconstruction of bilateral breast with silicone implants and an alloderm sling. So silicone implants here. Which one is this? So was this immediate reconstruction? Yeah, underwent immediate reconstruction of bilateral breast with silicone implants. Yeah, so I believe it's this one. Permanent implant is placed immediately. Mastectomy performed by breast surgeon, and an implant was placed at the same time by plastic surgeon. Yeah. And then now we talk about lymph nodes. Pathology report confirms invasive ductal carcinoma was limited to the breast. 0 out of 4 axillary sentinel lymph nodes were positive. So then there were sentinel lymph nodes biopsied. Surgical margins were clear, so we could put that surgical margins were clear. That's 0. Were there any other lymph nodes? All I see is sentinel nodes were positive. Margins are clear. But posterior margin was close with invasive carcinoma. I'm just going to say margins were clear because this is margins were clear. I'm going to leave that 0. Let's just see. And then I only see sentinel lymph node biopsy. So I'm just going to click this one. Surgery with regional, and this is 0. This one's 0. There's nothing about this. So score now. And yep, it's 100%. I'll do another one. Let's see. Let me pause. Oh,